morning and warm welcome, everyone. Thank you for taking time to join us this morning. My name is Samuel from SGH Patient Liaison Service Department, and I will be assisting with the running of today's talk. Today's topic is on dizziness, a common symptom experienced by many, but it can actually mean to describe many different sensations with various possible causes. This event is jointly organized by 3 departments: the SGH Department of Otorhinolaryngology, Head and Neck Surgery, the Department of Neurology, NNI at SGH campus, and Department of Physiotherapy. The 3 speakers, Dr. Sarah Hasner, Dr. Brenda Sim, and Ms. Grace Cole, will share with you on different aspects, causes, and therapy for dizziness. Throughout the session, you will have, if you have any question for our speakers, please submit it through the Q&A box, and we will try to address them for you during the live Q&A portion at the end of the session. Without much further ado, please welcome our first speaker, Dr. Sarah Hasner binti Abu Hassan, Associate Consultant, Department of Neurology, NNI at SGH campus, who will share with us more on the neurological causes of dizziness. What are the red flags? Which one are benign and which one can be serious? Dr. Sarah, over to you, please.
Okay, thank you, Samuel. Let me share my screen. Hang on. I think you need to stop sharing, Samuel. Sorry.
Oh, yeah.
Okay, good morning, everyone. All right, thank you to the organizers and to everyone who's tuned in to join in today's webinar. My name is Sarah. I'm one of the associate consultants at Neurology at Singapore General Hospital. And today I'll be giving a brief overview of dizziness from a neurology perspective. So first of all, what is dizziness, or even the term giddiness? It's a term that can sometimes be a little bit confusing and can mean different things to different people. But in general, we can divide dizziness into these 4 categories. So vertigo, disequilibrium, lightheadedness, and presyncope. And dizziness on its own may not always be a cause for concern, especially if it passes for a few moments, but we'll go through that in a little bit more detail later on. So this is just to show a brief explanation of each of these terms. So vertigo is a sense of illusion or a sense of spinning. Disequilibrium is the sense of imbalance or feeling off balance. And lightheadedness is, for example, the feeling that one gets from hyperventilating. And presyncope is a sense of feeling faint. There can be an overlap of some of these terms, and some people may experience more than one type of dizziness as well. So there are some red flags that we should be aware of, especially if the dizziness is something new or sudden or prolonged. And some of these red flags include a single attack of prolonged vertigo, which is that sense of spinning or movement. And it becomes a little bit more worrying, especially if it's associated with headache or any acute hearing loss. If there's any associated new or severe headache as well, or any persistent nausea and vomiting, and what we call focal neurological signs, which can be interpreted as stroke-like symptoms. For example, one-sided weakness, slurring of speech, drooping of the face, any difficulty with walking or unsteady gait, and double vision or abnormal eye movements. So causes of dizziness can vary, and there are a lot. Generally, we can categorize them in these 3 different categories. For example, neurological causes, ENT causes, and other causes, which can include things like medications, even mental health issues such as depression, anxiety, low blood sugar, or anything related to blood pressure changes. But my talk today will concentrate on the neurological causes, which I highlighted the more serious ones in red as well, but we'll go through these in turn later on. So there are some benign and serious causes. I will talk about these in turn, but this is mainly to show the more common or well-known causes of dizziness. So for example, stroke, vestibular migraine, which is a type of migraine, any space-occupying lesions or tumors, things like Parkinson's disease, any nerve damage, or even things like multiple sclerosis can potentially be causes of dizziness as well. So first of all, what is vestibular migraine? It is a type of migraine, and I classified it as benign as it's not life-threatening, but migraine in general can be quite distressing for some people. Patients commonly have a combination of dizziness, which is usually vertigo, as well as headache. And migraine in general is very common in the population and is actually one of the most common types of headaches that we see as neurologists. Headaches can be one-sided, throbbing, and can be with other symptoms such as sensitivity to lights, sounds, motion, with associated nausea or vomiting. And there can be different triggers of headaches as well, which can include things like lack of sleep, stress, any hormonal changes, certain types of food even, or weather changes as well. And treatment of migraines, including vestibular migraine, include identifying the potential triggers and making lifestyle adjustments to avoid these triggers. And sometimes medications if the attacks are frequent or very severe. We can also consider certain exercises called vestibular rehab exercises to help with these symptoms as well. And we normally ask help from our physiotherapy colleagues with this. So let's move on to stroke, which is a medical emergency. So it's definitely a serious cause for dizziness. And stroke occurs when the blood supply to the brain is not enough or is interrupted, which can cause damage to the brain cells. And there are two types of stroke, one due to blockage of the blood vessel and the other due to bleeding of a burst blood vessel. In medical terms, we call this ischemic stroke, which is the stroke due to a blocked blood vessel, or hemorrhagic stroke, which is due to bleeding of a burst blood vessel. You may also have heard of TIA, or transient ischemic attack, which is what we call a warning stroke from a transient blockage of blood flow. And most common stroke symptoms are drooping of the face, slurring of speech, weakness of one arm or one leg. And a good mnemonic to remember is FAST, AFST, because these are the most common symptoms. F for facial droop, A for weakness of the arms, S for slurring of the speech, and T, which is time to call 995. Another thing to note for strokes is that they are usually sudden onset. So if these symptoms suddenly occur, then the best thing to do would be to dial 995. But today, since we're talking about dizziness, some of the strokes which affect certain areas of the brain, particularly in the back portion or the lower part of the brain, which is the cerebellum and the brainstem here, can predominantly cause dizziness, especially the vertigo type of dizziness. And other symptoms that can occur as well with these sort of strokes also include slurring of speech, abnormal eye movements, or incoordination, loss of balance, or what we call ataxia. Okay, next up is on the series list of causes of dizziness are what we call space-occupying lesions. And usually this is due to a tumor or cancer. These tumors can be primary, meaning they originated from within the brain itself, or metastatic, which originated from outside the brain, such as from certain cancers, such as lung, breast, or colon cancer. If a patient is known to have these cancers, for example, and they do develop dizziness or any other symptoms such as headache, then it would be advisable to see your doctor to get it checked. If a patient, tumors or these metastases, in addition to dizziness, can also cause other symptoms which cause raised pressure inside the skull. And these symptoms include vomiting, blurring of vision, and other symptoms include change in personality, for example, agitation, memory problems, weakness, even seizures, and unsteady gait. So my next few slides will show some of the other neurological causes of dizziness, but they usually have other more prominent symptoms. For example, certain degenerative diseases such as Parkinson's disease or spinocerebellar ataxia, which is inherited, can also have symptoms of dizziness. But for example, Parkinson's, the main features are usually symptoms such as slowing of the movements, which we call bradykinesia, tremor, and rigidity. And the dizziness could be due to a sense of imbalance or feeling faint, and can be related to things like changes in blood pressure or from medications. Multiple sclerosis is an immune-related disease, and again, will often have other symptoms such as weakness, impaired vision, balance problem, bladder issues. And again, dizziness can be one of the symptoms, but isn't necessarily the main one. And we do have specific criteria to help diagnose multiple sclerosis. Peripheral neuropathy is due to damage to the nerves in the body's extremities, for example, the hands, arms, or feet. And common causes are from diabetes, alcohol, any vitamin deficiency. And patients tend to have symptoms of numbness, tingling, or even burning sensation. And they can also have weakness and difficulty with balance. And this balance and incoordination can lead to the sensation of dizziness. So in summary, doctors do frequently encounter patients who report dizziness, and it is our responsibility to define it as best as possible. On its own, it may not always be a serious issue, but there are some red flags to be aware of so that we don't miss a potentially sinister or life-threatening issue such as stroke in particular. And as mentioned before, the red flags that we look out for are things like sudden onset, one-sided weakness, any slurring of speech, any drooping of the face, incoordination or clumsiness, any severe headache, and sudden hearing loss. And if in doubt, it's always reasonable to check with your doctor. And if you don't have the red flags, but you do still have persistent dizziness, which you're not sure of what it could be, and again, it's always reasonable to check with your healthcare provider as well. So that's it for my brief talk today. Thank you for listening. Next up, I'd like to introduce Dr. Brenda Sim, my ENT colleague, to give her talk.
Okay, a very good morning to everyone and welcome to today's webinar on dizziness. I'm Dr. Brenda Sim, Associate Consultant in the Department of Otorhinolaryngology, Head and Neck Surgery. So in my segment of the talk, again, I'll be going through an overview of dizziness, and then we'll go through some basic ear anatomy and physiology so that we can have a better understanding on the conditions that I'll be covering later. And then we'll go through some ENT conditions causing giddiness, and then I'll conclude. Now, understand that dizziness is just a symptom, meaning it is a feeling you experience. It's not a diagnosis. So in medical terms, as Dr. Sarah mentioned, we broadly classify dizziness into vertiginous and non-vertiginous dizziness. In vertiginous dizziness, one would experience that either you or the environment around you is moving or spinning. However, sometimes one would feel more of an imbalance or disequilibrium rather than a spinning sensation per se. This is as opposed to non-vertiginous giddiness, where there's no illusory sense of movement. There are many causes that can result in dizziness, but broadly speaking, it could either be from the brain, the inner ear, or heart condition. So let's go through some basic anatomy of the ear. As you can see in this photo, there is the outer ear, which is what you can feel and touch, which comprises of the pinna, and the ear canal, in which earwax usually accumulates. Then there is the eardrum here, which divides the outer from the middle ear. And the middle ear is actually comprised of 3 small little bones called ossicles. And this mainly acts to conduct sound from externally through the ossicles into the inner ear. Now, the inner ear has 2 functions. One is for hearing, and the other is for balance. The hearing organ is also known as the cochlea, and the balance organ is made up of the 3 semicircular canals here, and the utricle and saccule, which is housed here. ENT conditions causing dizziness are mainly related to the inner ear. However, there are also conditions in the middle ear that can affect the inner ear due to its close proximity and cause dizziness as well. So here's a magnified view of the inner ear. The inner ear is actually covered in bone, and within it is called the membranous labyrinth, which is fluid-filled. So the blue areas are actually fluid-filled. And of course, there is also the hearing and the balance nerve, which supplies these 2 components of the inner ear. Now, there are a lot of ENT conditions that can cause dizziness, and this list is not exhaustive, but I'll be going through some of them. So let's talk about inner ear disorders first. Benign paroxysmal positional vertigo, or BPPV for short, is the most common ENT cause of dizziness. It is an inner ear disorder in which loose crystals are in the balance organ. So if you have this condition, what you experience is recurrent episodes of vertigo, and it usually lasts 1 minute or less. And it's worsened with head movements. So each time you turn your head, you will experience the giddiness and then it will subside. It should not be associated with worsening of hearing or tinnitus, also known as ringing or tinnitus, which is ringing sound in the ear. And there should be no weakness, numbness, or slurring of speech. Now, most of the time, we don't know why this happens, but in some cases, it could occur after vestibular neuritis, which is a condition I'll cover next, or after head trauma. And increasingly, there's also literature to suggest that low vitamin D levels can predispose you to BPPV as well. Let's watch a short video clip on the pathophysiology of BPPV.
Benign paroxysmal positional vertigo, also known as BPPV, is one of the most common causes of dizziness. There are two types of balance organs in the inner ear, the semicircular canals and the otolith organs. The otolith organs contain crystals of calcium carbonate, which are constantly being shed, dissolved, and replaced by new ones. If too many crystals fall off at one time, and the patient looks up or lies down before they dissolve, they can fall into one of the semicircular canals. When the patient rises, they don't fall out, they fall in and become trapped in the canal. Upon lying down, the crystals fall through the canal, causing an intense spinning that lasts a few seconds until the crystals fall to the lowest point. When rising, the crystals fall in the other direction, which again triggers dizziness. Until the crystals are dissolved, the canal may not work properly, and chronic disequilibrium as well as positional vertigo may be present. This will continue until the crystals in the canal dissolve or are moved out of the canal with special exercises or maneuvers. Even untreated, most cases of BPPV resolve within 14 days.
So what can be done if you have this condition? So if we see you in the clinic and you still have loose crystals in the semicircular canals, we can do some repositioning maneuvers for you, as you can see in this photo. And sometimes if you are found to have low vitamin D levels, we can correct it by giving you vitamin D supplements. Rest assured though that this condition generally resolves on its own after a few weeks. So you'll be completely back to normal. Now the next condition is known as vestibular neuritis. And this occurs when there's inflammation of the balance nerve, as you can see in this photo. Now, the balance nerve sends balance and head position information from the inner ear to the brain. So when the nerve becomes inflamed, the brain can't interpret the information correctly. And this would then result in a person experiencing symptoms such as vertigo and dizziness. Nausea and vomiting often accompanies it, and hearing should remain unchanged. It is thought that this is due to a viral inflammation of the nerve, and common viruses, such as those common flu viruses, measles, mumps, or even the chickenpox virus can cause this condition. Now, if you see a doctor with this, you would probably be given some symptomatic treatment, which means that you'll be given medications for giddiness, nausea, and vomiting. The doctor might also give you some antivirals, but very importantly would be balanced rehabilitation program. Now, the dizziness generally takes a few weeks to resolve, and some may even experience some imbalance months after. But generally speaking, you would soon recover from it in a few weeks to at most a few months, and majority of patients would only experience this once. Labyrinthitis is similar to vestibular neuritis in its symptoms. However, instead of just affecting the balance nerve itself, there's actually inflammation of the whole inner ear. So symptoms-wise, you would experience again sudden vertigo associated with nausea and vomiting. But unlike vestibular neuritis, you would also experience hearing loss or tinnitus. And depending on the cause of the labyrinthitis, you may also experience fever, ear pain, and headaches. On top of just viral inflammation, there are also other causes of labyrinthitis, such as middle ear infection. during which the inner ear gets implicated because of its close proximity. So the middle ear is actually here and the inner ear is here. So this middle ear infection, sometimes the inner ear might get implicated. Meningitis is also a cause. Meningitis means that there's an infection of the brain lining. And sometimes syphilis can also cause labyrinthitis. So again, what can be done? You would be given symptomatic treatment for your giddiness, nausea, and vomiting. And the role of steroids is mainly to salvage your hearing. Your doctor will therefore check on the suitability to start you on oral steroids. But this may not be suitable for patients with certain conditions like diabetes, because steroids can cause your blood sugar level to shoot up, or hepatitis, because it can predispose you to a flare if you're on oral steroids. So an alternative would be to give you intratympanic steroids, in which the steroids are injected through the eardrum into the middle ear, and then it would infuse to the inner ear. You may either receive antivirals or antibiotics, depending on the suspected cause. And again, importantly, a balanced rehabilitation program will help to train your balance organ again. Now, if your hearing loss persists after the ordeal, hearing aids may then be an option so that you can hear better again. Or if your hearing becomes so severe that hearing aids cannot help much, then cochlear implantation is an option too. So let's sidetrack a little bit to talk about hearing aids and cochlear implants. This is a picture showing the various types of hearing aids. You can see in the top row, these are the more aesthetically pleasing ones. This is completely in the canal. This is in the canal, and this is in the ear. And then the bottom ones are, this photo here shows behind the ear hearing aids. This is a receiver in the canal hearing aids and an open fit hearing aid. As a general rule, the smaller the hearing aid, the less powerful it is. So depending on your hearing level, the audiologist will then be able to discuss with you what types of hearing aids are suitable for you. So how does hearing aids work? Hearing aids work by amplifying sound through a three-part system. The microphone receives sound and converts it into a digital signal. And the amplifier increases the strength of the digital signal. And the speaker produces an amplified sound to the ear so as to overcome your hearing loss. So for patients with severe to profound hearing loss, for which hearing aids cannot help much, then cochlear implant is an option to help you with understanding speech better. However, cochlear implant requires a surgery. And the cochlear implant comprises of two parts, an internal component and an external component. The internal component is placed under the skin during the surgery, and with the thin wire called the electrode inserted directly into the cochlea. The part under the skin contains a magnet. So after the surgery and once the wound has healed, you would then put the external component over the magnet site, as you see in this photo, and it picks up the sound with a microphone and processes the sound and transmits it to the internal part of the implant via electrical signals, which then stimulates the hearing organ directly. After the surgery, rehabilitation is necessary to teach your brain how to interpret those electrical signals. The next condition would be Meniere's disease, and it commonly occurs between people ages 40 to 60 years old. Recall in my earlier slide that the inner ear is actually fluid filled, so the blue part is actually fluid filled. So in this condition, fluid accumulates in the inner ear, and there's hydrops or swelling of the inner ear. And it does so episodically, and each time it does, it causes vertigo, fluctuating hearing loss, tinnitus, as well as ear fullness. It progresses and fluctuates unpredictably. And you may even have periods of remission lasting from months to years before it occurs again. Up to now, the cause is unknown. But what can be done? Often, simple lifestyle changes like salt and caffeine restriction can help with symptoms. Medications for giddiness, that will definitely help. And sometimes if symptoms are not better with that alone, you may need a type of blood pressure medicine called diuretics to help get rid of the excess fluid. Intratympanic steroids or gentamicin may also be employed. And in intratympanic gentamicin, we are actually using an antibiotic that is known to be toxic to the inner ear to destroy the hair cells of the inner ear and thereby provide relief for you. Of course, this is not for everyone, and it's usually done for patients who are experiencing debilitating symptoms, and his or her hearing is already poor as a result of the disease. Surgery is also another way to destroy the inner ear, but again, hearing will be sacrificed. So it's usually reserved for patients with already poor hearing from the disease. In cases where hearing is poor and the patient wants something to be done, he or she may be fitted with hearing aids or cochlear implant. The next condition is known as third window syndrome, of which superior semicircular canal dehiscence is just one of them. So let's do a quick recap of the inner ear anatomy. Now, this is the inner ear, as I mentioned previously. The oval window, where the stapes bone sits, is one of the natural windows, and the round window is the second natural window. So third window syndromes are caused by defects in the bony integrity of the inner ear. As you can see in this cartoon, for example, in the case of superior semicircular canal dehiscence, the bone separating the superior semicircular canal and the skull base is actually thinned out. So every time a patient strains or experiences loud sound, the pressure from the brain cavity will be transmitted to the inner ear through the bony defect to cause giddiness. Other symptoms that a patient with this condition might experience is autophony, whereby you are particularly sensitive to your own bodily movements. For example, you may hear footsteps when you walk in your head, and you may also experience hearing loss. Not all third window syndromes are superior semicircular canal dehiscence though. It can occur anywhere along the inner ear. I had one patient with a bony defect between the main artery called the carotid and the inner ear. Now, please note that not everyone is symptomatic. In fact, there are cases where we see a defect on a CT scan done for another reason, but the patients have no symptoms pertaining to this condition whatsoever. So in such cases, nothing else needs to be done. Now, the next important but rare cause will be acoustic neuroma, also known as vestibular schwannoma. It is a benign growth of the nerve of the balance nerve, and it is non-cancerous. Now, a lot of times you might have no symptoms and it's incidentally picked up, but majority of patients will actually present with one-sided hearing loss or ringing sound in the ear. You may also experience giddiness or imbalance, especially if the tumor grows big. And facial numbness may also be a symptom. Now, this tumor is not common at all, and treatment is personalized. So depending on the size of the tumor and the rate of growth of tumor, the doctor will discuss with you, and the options would include just observing it alone, since it's benign. Number 2 would be radiotherapy, or number 3, surgery, or a combination of surgery and radiotherapy. Next, I'll go through middle ear conditions causing giddiness. Now, otitis media is just an umbrella term to mean infection or inflammation of the middle ear. It may be acute or chronic. And sometimes, due to the infection itself or the toxins from the infection, affects the inner ear, so giddiness may result. You can see in the upper photo here is a case of acute otitis media. So what you're seeing is actually the eardrum, and behind it is some yellowish fluid, which is actually pus. And in such cases, one would require antibiotic treatment. And sometimes a tube is inserted to drain the pus. I'll talk more about this later. In the photo below, there's a hole in the eardrum here. And there's chronic infection and inflammation of the middle ear. In such cases, eardrops will be required. And surgical options would include option to repair the eardrum so as to seal off the middle ear again and to prevent further infection. Now, this is a photo showing what a tube insertion is all about. So in this photo on the left, there's fluid in the middle ear. So this procedure can be easily done under local anesthesia. So we'll anesthetize your ear canal, and a small cut is made in the eardrum, and the tube is inserted to drain out the pus or any fluid there is. Now, this is a cartoon to show maryngoplasty, which is a repair of the eardrum. So in the photo on the left, there's a hole in the eardrum. And this surgery is usually done under general anesthesia. It takes about an hour to 2. And we would take a skin under the temple region of your, under the temple region, the skin's overlying the muscle there. And we'll use it to patch up the eardrum. Now, the next condition would be mastoiditis, which is a bacterial infection of the mastoid bone, which is the bone behind your ear. It is more common in children, but it can happen in adults also. Symptoms would include ear pain and discharge, swelling, redness behind the ear. You may experience fever, hearing loss, and giddiness, especially if the inner ear is involved. Other complications might include the spread of the infection upwards towards the brain, which can be life-threatening. So what can be done? Usually, you will need to be admitted for antibiotic treatment, and the definitive treatment would be surgery, in which the infected mastoid air cells or the mastoid bone is removed surgically. Now, what is cholesteatoma? Cholesteatoma is a non-cancerous skin growth of the middle ear. And although it is benign, meaning it's non-cancerous, it is locally aggressive, and it may erode surrounding bony structures. So the middle ear bones may be eroded to cause hearing loss. It can erode the bony part of the inner ear as well to cause what is called the labyrinthine fistula, to cause giddiness. And it can also erode the bone covering the facial nerve. So you might even get facial weakness. And above the middle ear is actually the skull base. So it might erode the bone there as well. Now, symptoms would include ear discharge, hearing loss, tinnitus, giddiness, facial weakness, and it also can get secondarily infected. So you'll get pain and fever. Now, this usually requires a surgery to create a safe and dry ear. So these are some illustrations of the mastoidectomy procedure. So again, this is the mastoid bone, which is the bone behind your ear. And you can see in the middle photo that this is a cholesteatoma. There's, involved the middle ear and gone behind the mastoid bone. So in doing surgery, we're actually removing all the diseased bone. And sometimes the ear canal is also removed as well. So we allow the mastoid bone to communicate with the external environment so as to make it a safe and dry ear again. Lastly, otosclerosis, in which there's an abnormal bone growth of the ear. It most commonly affects the stapes, which is the third bone or the last bone of the middle ear. But sometimes it can affect the inner ear as well. So patient mainly reports hearing loss and tinnitus. And this is due to the fact that the abnormal bone fixes the stapes to the oval window, resulting in sound not being able to be conducted from externally through the middle ear bones. And in females, it's often worse during pregnancy. In those where the inner ear is affected as well, you may experience giddiness. Now, what can be done? Hearing aids may be used to restore hearing, or stapes surgery. So the part of stapes is removed and the prosthesis is put in place so that it no longer becomes fixed, and sound can then be transmitted externally and transmitted through the 3 ear bones to the inner ear again. So with that, I'll conclude. The take-home messages are not all giddiness are ENT causes, and both inner ear disorders and middle ear disorders can cause giddiness. So that's all from me today. And I'll pass the time now to Ms. Grace Koh, who's a physiotherapist in SGH.
Thank you, Brenda. Okay, so hi everyone. My name is Grace. I'm a physiotherapist with SGH. So today I'm going to talk about vestibular rehabilitation and what is meant by physiotherapy for dizziness.
Ms. Scott, please switch the presentation mode.
Switch the presentation mode. Hang on. Huh? Is this better?
Yes, working now.
Okay. All right. So first, I'll be going through some frequently asked questions, which is how a physiotherapist can help me if I'm dizzy. What is vestibular rehabilitation? What can I expect from vestibular rehabilitation? Are the vestibular rehabilitation exercises easy to do? How long does it take to work? And what are the exercises that I can do? Okay. So how can a physio help me if I am dizzy? So people with inner ear disorders often feel dizzy and off balance. This puts them at a higher risk of falls. They may also start to avoid head movements and or cut down on physical activity. So physiotherapists like myself are trained professionals who can help with vestibular rehabilitation by treating the dizziness and prescribing exercises for dizziness and balance problems. So what is vestibular rehabilitation then? So vestibular rehabilitation is a customized exercise-based program to help with vestibular dysfunction. So the goals of vestibular rehabilitation include enhancing gaze stability. So we have patients who come in to say that, oh, when I turn my head quickly, sometimes I can't see things start to look a bit blur, and this causes me to lose my balance. So we can help with that. Improving balance. So like I said earlier, dizziness can cause some people to sort of slow down or cut down on movements. And they may also feel an imbalance as they are walking. So we can also help with balance issues. So improving vertigo. So vertigo, as what Dr. Brenda said earlier, is a symptom. What patients would experience will be a spinning type of dizziness. And if the cause is by BPPV, vestibular rehabilitation or physiotherapists will be able to help with that. So by being able to enhance the gaze stability, improve the balance, and also improve the vertigo, it also helps to improve activities of daily living. So what do I mean by activities of daily living? Usually things like getting up from bed, something that we do daily, walking, going to the grocery shop, going to the market to buy things, walking in a crowded environment. Those are examples of activities of daily living. Okay. So what can I expect in my sessions then? So our patients are usually seen in an outpatient setting. However, if you have dizziness that's overwhelming and that results in an admission to the hospital, we do have vestibular rehab trained therapists in the hospital who might be able to see you when you're in the inpatient setting as well. So on your first visit, we will be doing a comprehensive clinical assessment that includes gathering information on your symptoms and the triggers. We will screen the visual and vestibular systems, as well as test some of your balance systems. Some of these assessments may trigger dizziness, but it is important for finding out the root cause of the problem. Depending on our assessment findings, your physiotherapist can then advise you on the cause of the problem and discuss with you the plan of care for recovery. So patient education is an important part of the process as well. By patient education, what is meant is that we will explain the assessment findings to you. We can go a little bit more in depth into the diagnosis. By going through this patient education process, what happens is that it can demystify why the dizziness occurs, and it can alleviate some anxiety, as well as to help to increase your confidence in overcoming this dizziness. Canalith repositioning techniques may be performed for persons with benign paroxysmal positional vertigo or BPPV. This condition was explained earlier by Dr. Brenda as well. Okay, a customized exercise-based program may also be prescribed after the assessments. These exercises can include habituation exercises, vision stability training, gait and balance retraining exercises, some neck stretches or strengthening exercises, as well as general fitness exercises. So this is an example of some things that might happen during a session. So to assess your balance, sometimes we have this computerized dynamic posturography machine. So basically, you'll be placed on this machine with your feet apart in a harness. So don't worry, it's very safe. Okay, sometimes the floorboard might be moving, sometimes the wall might be moving. This will help us to assess the different systems that you might use to help with your balance. For patients with BPPV, we might put you on a Frenzel goggles. Okay, so this is called Frenzel goggles. The eye movements will be magnified and shown onto the TV screen for us to have a clearer look at the eye movements as you feel dizzy. So this can help with the diagnosis of BPPV. Okay. So are the exercises easy to do? So everyone likes easy to do things, right? So yes and no. Okay, the exercises are typically easy to do, not difficult to learn, but the exercises may make you feel dizzy at first. However, if you persevere, the body will start to adapt. And when you attempt the same movements in your daily activities or your daily life, it will be less likely to bring on the symptoms. Okay. How long does it take to work? Okay, everyone likes chop, likes it fast, right? So, but it really depends on what the root cause of the problem is. If the dizziness is due to BPPV, it can typically be resolved within 1 to 2 sessions of therapy with canalith repositioning techniques. If the dizziness is due to things like a vestibular weakness, it could take up to 4 to 8 weeks to see improvements in the symptoms. The longer the duration of the exercises, or the longer the duration of the symptoms, means that it might take longer to see an effect on the exercises. The effectiveness of vestibular rehab program also depends on the compliance of the patient to perform the exercises as prescribed. So it's going to be teamwork from the both of us, okay, from the physiotherapist as well as you guys. So let me show you a few videos along the way. Okay, so this is treatment for BPPV. When I talk about a canalith repositioning technique, basically we're explaining or talking about the Epley's maneuver for BPPV. So
their side, which is then held for
start from the front.
Normally, only with head movement does fluid within the inner ear also move, informing the brain that a head turn occurred. However, should a crystal called an otolith gets displaced into the posterior canal of the inner ear, BPPV dizziness occurs. Fluid movement occurs due to the crystal rather than head turns, causing the brain to think movement has occurred even though none has happened. The Epley maneuver is performed to treat this posterior canal BPPV by trying to get the loose crystal out of the canal. This maneuver is started by turning the head 45 degrees and the body laid back such that the head is extended about 20 to 30 degrees. If BPPV is present, eye twitching called nystagmus will occur. After 30 to 60 seconds, the head is turned at 90 degrees to the opposite side and held for another 30 to 60 seconds. The head is then further rotated another 90 degrees, accomplished by having the patient turn onto their side, which is then held for another 30 to 60 seconds. At this point, the head should be turned 45 degrees from the horizontal. When performing this maneuver, another individual can help with these position changes. The maneuver is then completed by having the patient sit up. So what's going on with these position changes? Essentially, the head is moved in such a way to manipulate the crystal to fall towards the canal opening. With each position change, it takes about 30 to 60 seconds for the crystal to settle into the most dependent position in the canal. If turns are made before the crystal has a chance to settle, the crystal may fall back the wrong way and the maneuver will fail. It's also important that the head positions are angled correctly, or else the crystal will not settle to the correct position in the canal and the maneuver will fail. Also, if the position changes are done too slowly, the crystal may not settle quickly enough from lack of momentum and the maneuver will also fail. Once the crystal falls out of the canal, the dizziness should resolve if due to posterior canal BPPV.
Okay, so with that short video, what is shown was a canalith repositioning technique for the posterior canal BPPV. So don't worry, the physiotherapist will guide you through this canal repositioning technique, so you don't have to remember how to position your head. As the video mentioned, certain angles are important for this maneuver, and the physiotherapist will be able to guide you through that as well. Okay, so we also have a brand thereof habituation. This can be a home-based exercise for people who have some remnants of BPPV left, or if the BPPV recurs again. So let's have a look at how to do this.
This is brand thereof habituation exercise. Begin this exercise sitting on the edge of your bed or couch. It is recommended that your feet be able to reach the floor comfortably so you can easily steady yourself when you return to the sitting position. Sit in the middle of your bed so you have enough room to lay down to each side. Turn your head 45 degrees to the right and quickly lay down on your left side. Allow your neck to relax with the back of your head supported by the bed. Wait for dizziness to subside, plus 30 seconds. If you are not dizzy, wait for 30 seconds. Quickly sit back up and wait for 30 seconds. Turn your head 45 degrees to the left and quickly lay down on your right side. Wait for dizziness to subside, plus 30 seconds. If you are not dizzy, wait for 30 seconds. Quickly sit back up and wait for 30 seconds. You have just completed one repetition of the Brandt Daroff habituation exercise.
Okay, so the brand thereof exercises would actually be repeated. So we'll try to go for a repetition of maybe 5 to 10 times if you can tolerate. Okay. Hang on. Okay, so habituation exercises can also be taught. So basically what habituation exercises are is to help to reduce the symptoms of dizziness by repeating or exposing yourself to the same movements again and again until the brain sort of recalibrates and understands that these movements are not harmful anymore. Okay, let's have a look. So oftentimes these movements are the ones that cause you to feel a bit dizzy. So common complaints that we have will be patients who report they have dizziness with turning their head, looking up and down as well, or sometimes even with standing, sitting to standing, or getting up and walking. Okay, so these are simple exercises that you can do even in the chair. You can do it safely at home as well. We recommend to repeat about 10 to 20 times, as much as you can tolerate. Don't worry if you can't tolerate it for a long period at first, because you can always start slowly. You can do to how much you can tolerate without feeling overly dizzy. Okay. So for the interest of time, I'm just going to skip forwards a little bit. Okay. So this first part was the exercises done in sitting. Then you can progress on to standing exercises. So this will be slightly more difficult compared to a sitting one. Okay. So you'll be doing the same movements, the head movements that provoke the dizziness, but in standing instead of sitting this time. Okay. So moving on a little bit more. Okay. Okay. So once again, you repeat the same head movement exercises, but this time around you'll be transiting from sitting down to standing up. This adds another level of difficulty to the exercises that you have just watched. Okay, so by getting up and sitting down, there is a bit of movement. So the brain needs to learn how to transit from movement with the head movements. Okay. And one more will be this one. Okay. So eventually we will progress to this, okay, walking while doing the head turns. As you can see, it was also a little bit difficult for the model. She had a bit of veering when she was doing the head movements with walking. However, this actually we will be simulating some of your daily activities with walking, with head movements. For example, if you think about when you're going out into a crowded shopping center, or even at the supermarket, when you're looking and standing up and down, looking at shelves and things on the shelves that you need to find. So this might be something that we will work towards with you. Okay. So another thing is we can do the same head movement exercises while you're walking on an uneven surface. I definitely don't recommend you wearing socks to do these exercises because it could be a bit difficult or dangerous rather. Okay, so for your safety, you need to make sure that you're doing these exercises near a wall or something that you can hold on to for support, or be supervised by someone who can give you a hand. Okay. Okay. So next up, we have gaze stabilization exercises. So remember, I mentioned something about when you're turning your head, and if the gaze starts to, you sort of start to see a blurred vision when you're turning your head or with fast head movements. These are some exercises that will start you off on. Okay.
This is VOR times 1. The target is stable, but the patient's head is set in motion. Over time, it's good to increase the frequency of the head movement. And you can perform these in a variety of planes, horizontal, vertical, and then in a diagonal plane. And the patient is trying to maintain gaze stability during the exercise.
And then this is VOR times 2. So times 1 is with the target steady, and then times 2 takes a little bit of coordination.
Exercise is VOR times 2, which means 2 things are in motion, both the subject's head and the card in converse directions. Perform this in a horizontal plane, vertical, and again in the diagonal plane. Maintaining your gaze on the target of interest, making sure it stays in focus, can increase the speed of head movement over time.
So we can make some of the exercises a bit more difficult. We can make some of the exercises a little bit more difficult by increasing the speed with which you do the exercises, changing up the surface where you're doing the exercises. So for example, whether you're sitting, whether you're standing on things that are a bit uneven or soft surfaces, and whether you're moving while doing these exercises. Okay. Okay, so then definitely for balance exercises, we also have a variety of exercises. After your balance assessments, we will be able to prescribe some balance tests for you. They can include tandem standing, which is standing with one foot in front of the other, balancing on a soft surface like a Bosu ball, okay, or even standing on one foot just to make sure that you are able to keep your balance for up to about 30 seconds. So standing on one foot, none of us stand on one foot in real life, but we do need some single leg stance to perform things like going up the stairs or crossing over a curb or an obstacle. Okay. So do make sure that you do have something to hold on to for support should you lose your balance while you're attempting these balance exercises. Okay, so these are a bit more higher level or a bit more advanced exercises for dizziness and for balance. You can have a look. So what she's doing right now is she's marching on the spot, looking with the head turns. So when we add in an element of head turns, it actually makes the balance exercises a lot more difficult. So ball circles, needing you to sort of focus on the ball while you're turning around and around, also helps you with your balancing. And it's also quite functional in the sense that you need to probably look around and look left and right, look up sometimes as well. So walking with head turns is one common one that we like to do, okay, because it's very functional, things that you need to do in your daily activity. Ankle swaying back and front on the floor will help with balancing, because if you lose your balance, a lot of times we will need our ankles to be able to give us a little bit of a push to regain our balance or to counter that loss of balance. Okay. Okay, so that's all for the exercises or the examples of exercises that I have first. Okay, these are not all that I can show you. There's definitely going to be more, but it's also going to be customized to the level that you can do. Okay, there's a disclaimer though. Dizziness can be a result of many different diagnoses as shown or as described by the doctors earlier on. So physiotherapy may not be suitable for all types of dizziness. So do consult a healthcare professional before you attempt these exercises. Then your physiotherapist would be able to customize a therapy plan for you after a comprehensive assessment. Okay, with that, these are my references, and thank you for your attention. I think it's time for the Q&A right now. So Samuel, are you going to go through, or will Dr. Sarah
Hi,
answer any
so
questions? Yep.
yes, thank you very much, Ms. Cole. So I think now it's time for the Q&A. We have many questions submitted by the audience, and the doctor also picked out a few to address. Maybe we can start with Dr. Sarah. Which question would you like to answer, Dr. Sarah?
Hi, okay, let's see. All right, so I think one of the first questions was regarding postural hypotension. This person had a coronary artery bypass and then had postural hypotension and subsequently had vertigo diagnosed last year. Okay, so postural hypotension is a known cause for dizziness. It's not uncommon that medications can contribute to the symptoms of dizziness. I would probably advise actually to have your doctor check your blood pressure when you're lying down and when you're standing up to see whether there's any significant difference. Certain medications, especially things like blood pressure medications or heart medications, can affect this. So I probably wouldn't be able to advise on the actual medications, but again, you should see your cardiologist or your primary healthcare provider to check your blood pressure and see whether there's any difference on lying down and standing up. Samuel, I think we can go on to the next question, which is somewhat similar. When I stand up too quickly after squatting for more than 30 seconds, I feel lightheaded for 7 seconds. Yeah. Okay, so again, this is not an uncommon symptom to have. It's not necessarily a sign of stroke or heart disease. But again, if it's persistent and the symptoms don't resolve, then I would again check with your doctor to have your blood pressure checked as well. The reassuring thing is that your blood tests are normal and that they don't have the same symptoms with other activities. So it does sound that it may not be something very sinister or serious, but as I mentioned, if it is persistent or if your symptoms don't resolve, then you should get it checked out.
Okay, what will be the next question, Dr. Sarah?
Hang on, let me see.
Okay, maybe this one. Yeah.
Oh, yeah, okay. Right. So the short answer is yes, it can. If you have a lot of emotional stress or a lot of high stress, anxiety, yes, it can cause headache and dizziness. It is actually a fairly common sort of factor contributing to migraines as well. So the short answer is yes, but again, if it's persistent, it may still need to be looked at.
Okay, thank you. I think we have one more question.
And this one, not particularly related to dizziness, but I thought I'd just answer it since it was a question that was brought up. So transient global amusia is a sudden memory loss. Usually the person is still alert, attentive, but they can be disoriented, not knowing where they are or confused about the time. So I don't think dizziness per se is a feature of this, and it's not really known to be due to low vitamin D levels.
Okay, thank you so much, Dr. Sarah. I think now let's move on to Dr. Brenda Sim. Okay, I think we have one first question is what causes cholesteatoma? I'm sorry for this.
Yeah, so cholesteatoma, just to recap, it's a benign skin growth in the middle ear. So broadly, it can be broadly classified into congenital, meaning that you are born with it, so or acquired. So why are you born with it? For some people, some of the skin cells gets trapped in the middle ear where it's not supposed to be. And then with time, the skin cells grow to become a cholesteatoma. And often you would see congenital cholesteatoma in children, and they often present maybe either in primary school age or sometimes even during secondary school when they do hearing screen at school. Now, nobody knows why congenital cholesteatoma happens. Whereas for acquired cholesteatoma, Typically, it is due to eustachian tube dysfunction. So there's a tube that connects your nose to your ear called the eustachian tube. And for whatever reason, it is dysfunctional. It causes a negative pressure in your middle ear. And if so, the eardrum gets retracted and tends to trap the skin cells and therefore cause cholesteatoma. Other causes would include, like, for example, if you have a perforation in your eardrum. So remember, the eardrum actually divides the outer ear from the middle ear. So if there's a hole in the eardrum, skin cells can then migrate from the external ear into the middle ear to cause cholesteatoma. Or sometimes for whatever reason you have a tube inserted, sometimes it can also introduce some skin cells in the middle ear to cause cholesteatoma. Of course, I'm not saying that everyone who has ear tube inserted would have a cholesteatoma, but that's a small risk of it. Yep. So, yeah. Shall we move on to the next question?
All right, so the next question is, do cleaning up the ear canal with cotton buds have any effect on hearing, etc.?
Yeah, so usually as ENT doctors, we usually advise that ears are actually self-cleaning, meaning to say there's no need to regularly clean them. In fact, some wax is good because wax have actually some antibacterial properties. Now, what happens when you persistently clean them with cotton buds? Sometimes the cotton bud is so big that in fact, you're not cleaning the earwax, you're actually pushing them in, and the earwax actually gets impacted. So you will get hearing loss as a result of sound being not able to be conducted externally through the middle ear into the inner ear because it's blocked by the impacted wax. And other problems that, by using cotton buds would be that sometimes you do not know the depth that you are cleaning your ear. So a lot of times I've seen many patients in which during the cleaning process itself, they actually perforate their eardrums and cause a hole in the eardrum. So for this reason, we usually advise one not to, need to routinely clean your ears with cotton buds or not to instrument your ears at all. Yeah.
All right. Okay, so this is the next question. Can vertigo be cured permanently? Will a chiropractor be able to resolve this problem by twisting the neck or something?
Okay, so again, vertigo is just a symptom. There are many causes of vertigo. If they are caused by, an ENT cause, like the most common cause would be BPPV, then of course repositioning maneuvers would help. But repositioning maneuvers is not the same as twisting your head or your neck. So we'll actually reposition them as mentioned in Grace's talk. That's how we would usually do it. Yeah.
Okay, thank you. So a few participants are not sure about what crystal are. Could you re-explain it to them? And are there any ways to resolve the crystal in the PPV? Yeah.
Yeah. So crystals are actually found within everyone's inner ear, and they are actually in the otolith organs called the utricle or the saccule. And sometimes, and often, they are actually, released and they are absorbed by the body routinely. So sometimes if too many are released at one go, they might actually fall into the semicircular canal, and that's when BPPV happens now. So to answer your question, yes, the body does dissolve the crystals, but if too many get released at one go, as in the case of BPPV, then you need some kind of repositioning maneuver to move them to a place where it doesn't irritate, no longer irritates the inner ear again. Yeah, and there's no like medications to help to dissolve it. It's more repositioning maneuvers.
Okay, thank you so much, Dr. Brenda. So some people also asking about the BPPV, and it come back or it doesn't resolve after a few weeks. What could be the reason and what can be done?
Now, if you have symptoms of BPPV that is suggestive of BPPV rather, and it doesn't recover after a few weeks, I think I would suggest that you go and see a doctor, because if it's truly BPPV, then the doctor would be able to reposition them for you, or even a physiotherapist. And we also need to rule out other causes that would cause similar symptoms to BPPV, but it's not BPPV. So I would advise that, you see a doctor to get this sorted now.
Okay, thank you. Some people also are asking about all the other related ENT conditions such as sinusitis. Does it have any effect or could be the cause for giddiness, and how do one prevent giddiness from happening?
Generally, sinusitis does not cause giddiness. If it causes, if you have giddiness and sinusitis, I think it could be a coincidence, but sometimes sinusitis can cause headaches, like frontal headaches, or facial pressure and your facial pressure or pain. And typically sinusitis would be accompanied by symptoms such as blocked nose, discolored nasal discharge, or some smell disturbance. Either you smell something foul smelling in your nose, or you have some loss of sense of smell. Yeah.
Okay. Thank you so much. I think we also have one participant asking about his or her mom. The mom is 78 years old, diagnosed with labyrinthitis about a month ago. She also had vertigo, tinnitus, followed by hearing loss. She was given oral steroids and antiviral medications. The question is, will she be able to regain her hearing loss? And usually how long it's going to take? Does hearing loss affect one's balance?
Yeah, so it's a bit difficult to give you a standard answer as to when the hearing would be recovered, simply because for different patients it takes the timeline is different. So for some patients, the hearing can recover back to normal or their baseline, and typically this would happen within 6 months. But I've had a patient who came back to me 1 year later, and at 6 months, actually her hearing didn't recover, but at 1 year it did recover. So that was very surprising. But generally, I would say that if hearing recovery were to happen, it would generally happen within 6 months. Now, so that's how long it takes. And does hearing loss affect one's balance? The short answer is yes, it can. So increasingly, there are papers coming out or research studies coming out to say that for the elderly, hearing loss can affect his or her balance. And therefore, it is important to rehabilitate the hearing loss either by means of hearing aids or otherwise. Yeah.
Okay, thank you very much, Dr. Brenda. I think now we have some questions for Ms. Grace Ko on the exercises. So in particular, exercises such as habituations are done during days of giddiness or when the symptoms were over. Ms. Grace, can we have your advice on this, please?
Yes, hi. So habituation exercises can actually be done at any time, but I don't recommend that you do it at the height of your giddiness. That means when you're feeling the most giddy, you shouldn't continue to try to do. Most of the time, it depends if your giddiness is an on and off kind or whether it's constantly there. So if it's on and off, or if it's constantly there at a very low grade, then you can actually start to do some habituation exercises. Definitely, we don't recommend that you avoid activities or avoid head movements when you're dizzy, because that could make it even worse in the long run. Okay. The next question, please, Samuel.
Thank you. I think this question you have typed in the chat box, but I think we just repeat it here again. What can be done for senior with vestibular hypofunction?
Yes. So I think the most important thing is to find out whether it is really vestibular hypofunction in the first place. So to get a doctor or the physiotherapist go to the physiotherapist or the doctor for an assessment first, and then find out what are the impairments that the senior might have. So for example, it could be balance issues, it could be gait stability issues, or it could be dizziness on certain head movements or certain movements that, for example, like lying down and getting up. And with the assessment results, we can then we'll be able to then prescribe some exercises for the seniors to do. So habituation exercises, gait stability exercises, as well as balance ones can be done safely even with seniors. So don't have to be worried about that. Just do ensure that maybe you get the exercise plan prescribed by a healthcare professional first. Okay.
Okay, thank you very much, Ms. Grace. I think this question, I am not sure any of the speaker can help me. It's actually quite a common question by many of the participants. When I raise my head for duration of time, or when I do certain exercises which require raising up head or while lying down or standing up too abruptly or feel giddy. So it's quite generic, I would say. And what just a summarize for the participant, what are the causes and what does she need to be concerned about this?
I can take that question. So I think similar to my previous answers, it could be related to a sudden or brief change in your blood pressure. What happens is when you suddenly stand up, there's some temporary pooling of your blood in the legs, basically. And this shift in the blood flow can cause dizziness. So in terms of causes, it really depends. Some people who are on blood pressure medications, or if they are dehydrated or have low blood counts, it can exacerbate these symptoms. But it's not entirely uncommon. It really depends on how frequent, how severe the symptoms are, and what your actual blood pressure is that you may need to get it checked out.
Okay, thank you very much, Dr. Sarah. I think that's all the question that we have for today. Maybe we can just cap the session up by some final advice from one of you, each one of you. Yeah. Can we start first with Dr. Brenda? Yeah.
This question, is it?
Oh, no, sorry. Just say a few words to recap and give the audience some advice so that we can close the session. Yes.
Yeah, so I'm sure giddiness is quite a common problem. So if in doubt, I think the first line would be to see your GP, who will triage your problem. And then if there's any need, they will refer you on accordingly to the correct specialist.
Thank you. Ms. Grace, please. Yeah.
Yep. So I think like what Dr. Brenda was mentioning, that dizziness is actually a very common problem. I think it's more common than most people would think. So it's always best to get it sorted out early on so that you can prevent any future secondary problems that might occur from prolonged like lack of movement or avoidance of movements. Okay.
Thank you. And Dr. Sarah, please.
Yep. Okay. So yeah, as mentioned before, dizziness there can be a lot of different causes, and the term dizziness itself is something that everyone needs to try to define as best as possible. It is up to your doctor when you see them for them to take a full history, examine you well, so that we can get to the bottom of what your actual symptoms are and what the underlying cause is. So just keep in mind the red flags that we've mentioned, and if there's anything else that you're unsure of, then it's always reasonable to see your GP first or see a specialist if needed.
Okay. Thank you so much, all speakers, for, I think, very informative sharings on the dizziness. I think we all know this very common. I think everyone can use it to describe their situation one day on a few days a week, maybe. So it's good to know that there could be good, like benign or could be serious causes, and what we need to watch out for when this has happened to us. So thank you to the participants for joining us today for this Saturday morning. So the video will be uploaded to SGH YouTube by about 1 week later. And as I mentioned, we will share with you or notify you through the registered email so that you can watch again and maybe relearn some of the things that we missed out of this session today. This afternoon, we also have another webinar by the Department of Hematology. If you have time, please feel free to join us. So once again, thank you so much for spending this Saturday morning with us. Stay safe and see you again soon. Goodbye.